problem was that we were treating all appointments, all access to healthcare as if they were equal. Well, the first thing that I had to do was to assess the situation and determine if there was really a problem. And I was able to, by using the significant data resources at VA, quickly understand what the problem was. And the problem was that we were treating all appointments, all access to healthcare as if they were equal. So the first thing that I did was I made the VA change the way that they categorize their appointments to either urgent clinical needs or routine clinical needs. And that helped put clarity on the situation so that we're doing what a health system should do, which is to prioritize those that need the help the most to ensure adequate access, and make sure that those that have routine needs have access, but they're not in the same timely fashion. So once we were able to change the way that we were viewing the system, it was very clear to me what we needed to do. The second thing that I did as the leader is I determined a new standard, and that new standard was same-day appointments. That if somebody had an urgent clinical need, they were going to be seen the same day, whether it was a physical or a behavioral health care urgent need. And that put clarity on the system for the 400,000 employees about what their job was and what that standard was going to be. Previously, that had been a 30-day standard, and as a doctor, I don't know how to manage my schedule within 30 days. I just know I have a patient in front of me. They either need to be seen now or they don't. And so that clarity helped. Once we had that, then I used specific tactics. One of them was I granted full practice authority to advanced practice nurses and pharmacists so that we could begin to start having additional experienced healthcare professionals begin to take some of the workload off of our primary care doctors and other doctors. That made a big difference. Yep. Secondly, I rapidly expanded telehealth, and that required some regulatory changes that actually we got across the country so that we could begin to start using our workforce who had capacity in one part of the country to help other parts of the country. Prior to that, there were regulatory barriers, but I was a federal agency head, so I had what was called federal supremacy, where I could go above the state levels and change those regulations. There were a number of other tactics that we used to be able to, get this done. We shortened some wait time appointments, and we did what were called sprints in the medical centers, where they would deal with those that had clinical urgent needs first. And finally, we opened up what's called the community care system, which is when veterans weren't able to be seen in a timely fashion, we made it easier and finally permanent law that they have the right and the ability to go and to see doctors or hospitals or other professionals in the private sector.